Mesothelioma is an aggressive form of cancer that develops from the mesothelium, which is a protective lining that covers most of the body's internal organs, the lungs, the heart, and the abdomen. It is usually caused by exposure to asbestos. While there is no known cure for mesothelioma, some herbal remedies and supplements may help reduce symptoms and side effects from standard medical treatments. People should always talk to their doctor before trying any herbal or complementary therapies, as some may interfere with chemotherapy or other prescribed medications. Additional research is still needed on many of these natural options. Turmeric, curcumin longa, is a bright yellow Indian spice that contains active compounds called curcuminoids, the most important of which is curcumin. Curcumin has shown promising anti-cancer properties in laboratory and animal research. It appears to help slow or stop the growth of mesothelioma cells and may make chemotherapy more effective. Turmeric is very well tolerated, but the amount of curcumin able to reach the tumor sites from oral turmeric may be limited. Absorption can be increased when turmeric is consumed with black pepper since piperine in black pepper enhances bioavailability. Clinical trials are exploring whether turmeric extracts or curcumin in higher concentrated forms may have benefits for mesothelioma patients. Mushrooms like shiitake, lenticinids, Maitake, Grifola frondosa, reishi, Ganoderma lucidum, and turkey tail, Coriolis versicolor, have a long history of use in Chinese medicine and are being studied regarding their effects on cancer. Some research suggests certain mushroom extracts may inhibit mesothelioma cell growth, cause cell death, or work with chemotherapy. Beta-glucans are polysaccharides found in the cell walls of mushrooms that are believed to stimulate the immune system, which may help combat cancer. Mushroom supplements are generally well tolerated, but drug interactions are possible. More research with human subjects is still needed. Green tea, Camellia sinensis, is high in powerful antioxidants called polyphenols, especially apoptosis 3-galate, EGCG, which are believed to help protect cells from damage. EGCG has been shown to inhibit mesothelioma tumor growth in animal and test tube studies by stopping the cell cycle and inducing cancer cell death. It may help sensitize mesothelioma cells to chemotherapy as well. Green tea is very safe for most people when consumed in moderation, but drug interactions or side effects are possible. Further studies are investigating concentrations needed for anti-cancer activity. Garlic, Allium sativum, contains organosulfur compounds such as diallyl trisulfide and S-allylcysteine, which have been studied for their possible anti-cancer effects. Garlic consumption has been linked to reduced risk of several cancer types in some population studies. Research suggests components in garlic essential oil may inhibit mesothelioma cell growth by inducing apoptosis, programmed cell death. It is generally safe in food amounts for most individuals, though strong odor and gas are common side effects. At this time, its benefit for mesothelioma is only preliminary due to lack of human clinical trial data. Ginger, Zinniber officinal, is another spice with possible anti-cancer activity. It contains gingerol and other phenolic compounds that studies indicate may help stop mesothelioma cell proliferation, decrease tumor growth factors and stimulate cancer cell death. Ginger is considered very safe as a condiment or supplement for most people. High doses in supplement form could potentially interact with medications. More research is still needed regarding ginger's effects in humans with mesothelioma. Another herb, holy basil or Ulci, Ocimum tenuiflorum, has yielded intriguing results in preclinical research. Studies show extracts from its leaves may induce cell cycle arrest and apoptosis in mesothelioma tumors, as well as inhibit cancer cell invasion and spread. Holy basil is generally regarded as non-toxic. As an emmenagogue, plants that stimulate menstrual flow, it could theoretically interact with medications or increase bleeding risk for some. Effectiveness for human mesothelioma also requires further investigation. Asian ginseng, Panax ginseng, is an adaptogenic herb long used in traditional Chinese medicine to strengthen overall health. It contains ginsenosides and other compounds that studies propose could help slow mesothelioma progression. Ginseng may sensitize cancer cells to chemotherapy, inhibit cell signaling pathways linked to cancer growth, and impart antioxidant protection. While Panax ginseng is considered relatively safe for most adults when used properly, drug interactions or side effects are still possible, especially with long-term use, so it too requires additional human-based research for mesothelioma. Maitake mushrooms, shiitake, reishi and turkey tail are among the natural options getting more attention regarding adjunctive use for mesothelioma. Each offers a unique mix of compounds with various antioxidant, immune-boosting and potential anti-tumor activities that preclinical research links to mesothelioma reduction. Clinical trials are still in development to solidify effectiveness and safety for human applications. Overall, while herbal remedies may provide adjunctive support, mesothelioma patients should always work closely with their medical oncologist regarding any complementary therapies due to the need for careful management of this aggressive cancer. Clinical research offers the best hope for reliably showing benefit, but continued basic studies of plant medicines contribute to reducing the suffering of mesothelioma worldwide.